Had lots of fatigue. I hurt everywhere. I had been into doctors to see what could possibly be wrong, and nobody could diagnose me.
So Lyme disease, it's one of the most controversial illnesses in the history of medicine. It's the fastest growing infectious disease, and it's quickly sweeping the country as more people are starting to understand it, understand the symptoms, the exposure, and the risk factors.
From the beginning, the first symptoms I noticed was a racing heart, shortness of breath, and from there it went to left side numbness and slowness of my hand. I'm a piano teacher, and I noticed that I was really slowing down in my playing. Here I was last Monday, and was telling Dr. West all of my symptoms, and all this, I went in thinking, I went in skeptical, and I thought, you know, I'm not going to say anything about the cyst. I'm going to see if this guy can figure me out. The numbness on my left hand and my leg. I played in church. I haven't played in church for 5-6 months. I stopped, and I'm a piano teacher, and that's what I love to do. Very skeptical. What can vitamins and a little tweaking do? You know, these symptoms were real, and in my head I was going downhill fast. I mean, I didn't know what I had, but I knew something was happening. And for him to tweak and just relieve that was amazing.
You can have every Lyme symptom in the book: fatigue, brain fog, joint pain, and still be told you're fine, but still sick. And if your Lyme test came back negative, you can have the Lyme symptoms, over 40 main symptoms. And your doctor may still be telling you, hey, it's fine, it's all in your head, quit looking on the internet. And that's because the standard Lyme tests your doctor uses were designed decades ago to detect acute infections and not the chronic or relapsing ones that people struggle with today. How long have you been sick?
As long as I can really remember.
Okay,
honestly. So 20 years.
Some infectious disease, tick-borne illness involvement. You did a whole bunch of stuff in healthcare.
He had been sick for, as he said, probably 20 years of his life. And we were at a place where he needed help. It was the end.
So we did a really high dose vitamin C infusions, dilute hydrogen peroxide, dilute hydrochloric acid, ultraviolet blood irradiation therapy, amino acid therapy.
Neural therapy.
So that's how we reboot nerves. It's a way to get the nerves to open, close, and reset.
Acupuncture as well.
Okay, so again, just trying to line up your energies. We gave you some supplements. Yeah, so when you load up the body with building blocks, I like to tell people it's kind of like there's a crew, a construction crew waiting for the lumbar truck to come up to be able to, you know, have a bunch of, to build a new house.
I all of a sudden just saw, it was like a light switch almost. He would come in the morning and I was almost like, who are you? And emotionally he was in a better place, and I could tell physically, definitely he was in a better place.
Let me ask you something. Have you ever been told your labs look normal, but you still feel awful? You're tired all the time, you're inflamed, your brain is foggy, maybe your body just keeps feeling off and you keep hearing, everything looks fine. If that's you, I want you to know this. You're not crazy and you're not imagining.
It took me over a year to get diagnosed. And so the first thing they were saying that it was fibromyalgia. Well, possibly it might be an autoimmune disease. When all of that basically came back negative, my physician that, you know, I'm currently seeing basically said, oh man, I hope it's not Lyme disease, because if it is, there's nothing I can do for you because you're in the chronic stages, according to guidelines.
You came here how long ago?
Over a year ago now, I think.
Okay, so it's about a year. And from the time that you started to now, you marked on your paperwork that you were a percentage better. What was it?
Today,
Yeah.
65%.
Okay,
better.
so, and then what does that allow you to do? Because I know it's not 100%. You still have work to do.
We still
but
got work to do.
What can you do now?
So I'm able to cook my own meals. So I'm able to cut up vegetables now. I started physical therapy, so I can walk back and forth in a pool, which would have been absolutely impossible a year ago. And I only have to sleep 2 hours a day as opposed to basically all day. What I want people to realize about Lyme disease is it is very prevalent and it's hard to diagnose. And a lot of doctors just don't recognize it. There isn't the knowledge base and understanding out there. So keep searching for answers and keep pushing for better testing and patient and physician education.
Hey, you guys, Dr. West here. I'm so excited to share with you some Lyme information. If you have been told, hey, your blood tests look normal and you feel awful, then this is the presentation for you. I just wanted to review some things. We're going to go over some sample tests, and I want to explain one of the things that happens with people that don't feel good. Their muscles hurt, their heart's off, their hormones are off, and yet they go in, and we just had this happen to us today. They go to their doctor, and the doctor's like, well, everything, looks normal, so maybe you're depressed, or maybe we should try, some prednisone. So everything that I'm covering, I'm telling you about, is in my best-selling book called Hidden Secrets to Curing Your Chronic Disease. And we also have a really neat resource for you, because my goal is to help as many people as possible to beat Lyme disease. So I want to go in and share with that right now. By the way, everything you can just jumpstart to our Lyme Fighter guide here at lymefighter.com. We have a free resource there for you to look at, which helps to talk about the testing, but let's go over testing right now. And I have a couple examples that I wanted to share with you. And one of the things that happens is if I take my little, and draw a bell-shaped curve like this. And so we have this right here. And this is the middle, right down here. What happens in medicine so many times is you go out 2 standard deviations to here and to here, and then they say everybody in this population should fit in this category. And if you're over here on the side, what happens is they're like, oh, well, you have disease over here, you have disease over here. That's when they start treating. And it leads to so many problems, because it's the deviation from optimal that really is the key. So you guys, if I just pull this up here right now, I'm looking at a blood test that of someone that has Lyme disease. And so let me just walk you through kind of what's happening in this process. Number one is we look at, and these are standard routine tests, you guys. This is some really good information right off the bat. This thing right here is your white blood cell count. This tells me, is your immune system functioning? Now, ideal levels are, 7 to 8 right in here. And so one of the first things I know from this patient is their immune system's off about 20%. It is literally in a place where the guard dogs that are supposed to chase off the bad guys, the Lyme disease, the bad guys broke into the house. And what happens is the guard dogs aren't chasing off the bad guys. So what happens is they're supposed to, again, protect the body. And what happens instead is they're like, hey, the family jewels, well, they're over here, and the guns are over here, and, the electronics, they're over here. You should go get those, right? And instead, the dog should bark and go after it. So looking at this test right here, we can see white blood cells are a little bit off. The red blood cells, hemoglobin and hematocrit, they look pretty good. And then you guys, if I could teach you one thing, it literally is going to be right here, looking at your blood test levels and helping you to figure out these guys fight bacteria. These guys fight viruses. This is inflammation right here. And this numbers, if you know these numbers, you guys, this can unlock so many different things. Because if your bacterial fighters are working really well, what occurs is we know that your body is at least responding to one phase of the Lyme disease. Now, there's 5 phases of Lyme. There's one, we have the spirochete phase. Number 2, we have the intracellular phase. Oh, okay. So let's try this again. Spirochete phase is that's what the bacteria gets you. Then the intracellular, it goes inside and hides from the body. And then what happens is we have the spore phase, which is the dormant phase, and then we have what's called the biofilm phase and the budding phase. And in that process, the different phases respond differently to the immune system. In my opinion, the antibiotic approach that so many Lyme doctors do, it only works in phase one. It only works in the spirochete phase, and then it hides from the body. This is why Lyme disease is literally the great imitator. So looking at labs, we want to see, are your labs balanced? Is your white blood cells in the right number? Are the ratios of bacterial fighters, which should be 60%, and your viruses 30%, and your garbage cleaners should be 8% or less, and your allergy marker, like that is so easy to determine off a simple routine blood test. And then we start looking at your metabolic panel, looking at, on this patient, high glucose markers, his blood urea nitrogen, which is really a kidney urine and nitrogen marker, looks really good. His glomerular filtration rate, his kidneys look really good, sodium, potassium, chloride. And then we get to this number right here. This is a really, really important number that's so oftentimes missed in labs, and it's this guy right here. This is your calcium levels. Now, here's the deal with calcium. It's the most important, most abundant mineral in the body, and it's so important for triggering what we call the complement cascade. So it's important for bone health, it's important for your immune system health, but it's also really, really important for signaling the body to basically the immune systems to start. This number should always be, around 9.8. I never like to see people, below 9.0 is really bad. I see a lot of problems with this calcium level. And so this is one of those classic examples. They're being told everything is normal. And then what happens is the patient's like, well, I don't feel very good. And then maybe one of the most important things that we see on this test, in my opinion, is this. This is a gem right here. This is called alkaline phosphatase. Now, what happens with alkaline phosphatase is this is a bone, liver, muscle enzyme, which shows basically if there's any abnormal reactivity from your bones and muscles, but also this is linked to your pituitary function and your adrenal function. And basically, you guys right here, this is located to your energy. So let me erase this so we can see this number right here. This number ideally should be 100. So I know this patient. So here's what's happening, looking at these labs the right way. Number one, immune system's down. The guard dogs really aren't revving up to fight infection. The patient comes in and says, I haven't felt good. I've had all of these different diagnoses. And what happens is I feel horrible. So we run these routine labs, and I'm going to show you some additional labs that are really good information. But just that first thing, the guard dogs aren't working, then the minerals aren't working. He can't go basically and do the immune system. And one of the most important things that happens is if this is a bacteria right here, we have the white blood cells come up to it and they go around like this and they engulf that bad bacteria. We call that process phagocytosis. It's the engulfing of that bacteria. And it doesn't work without ideal calcium levels. You have to have calcium right around that 9.8 mark. And the cliff that people fall off is it's 9.0. So if you remember anything, it's this. Calcium, here it is right here. 9.8 is ideal, okay? 9.0 or less, like that's literally dropping off a cliff. And helping this patient just with those things, stimulating the immune system and helping his calcium levels are going to make all of the difference for him. Also looking at this energy marker, again, look at this on your blood tests. Now, it's super important as a bone, liver, muscle enzyme, but it also is a little window in looking to see what's happening inside of those blood tests, because this alk phos number right here, this is an indicator of your energy. And this is where we really need to work on the hormone precursors going in your body, particularly what we call the adrenal hormones, the DHES. Those are so important, and it comes from the pituitary to the thyroid to the adrenals, which, by the way, you guys, here is just a gold nugget to help you at home. You don't need a doctor to figure out if you're having healthy adrenals or not. We just need to do a simple test called Ragland's test. And so here is what Ragland's test does. You literally get a blood pressure cuff, and you want one that also measures your pulse rate. And here's what happens. We put that blood pressure pulse rate right here. You lie down, get your blood pressure. It should be 120/80. That's kind of the ideal marker right here. And your pulse rate, you guys, should be 60 to 80 is kind of the normal range. So that's your blood pressure lying down. Then we want to do something, do a little mini stress test. And we just want you to stand up, and we want you to measure your blood pressure and what's happening with your pulse rate. Now, this is developed by a famous hormone doctor named Dr. Raglan's. They named the test for him. And ideally what should happen is your blood tests should be 126/86. It should go up a little bit. And the pulse rate, well, I don't know how we got that on there. The pulse rate, let's see, I can move this, dang it. Okay, here's what happens. The pulse rate should stay the same. So going over and doing the simple test, 120/80, here we go. Pulse rate 60 to 80. When you stand up, 126/86, pulse rate 60 to 80. You know what happens with most people is they may even have normal blood pressure, and then when they stand up, their blood pressure will drop and it'll go like, 114/70. And then what happens is their pulse rate can go up to like 100. This is such a neat way, you guys, to look in and get information about how you respond to stress, your heart and your adrenals. Also, looking over at these tests right here, we can see that the patient has some liver problems. With the the cholesterol right here is 156. And I'm not worried about cholesterol in a cardiovascular standpoint, because it's cholesterol is not what causes cardiovascular problems. You know what causes cardiovascular problems? It's inflammation. And then that sticks the cholesterol. And here's what's happening is the body is trying to create cholesterol in response to stress. So if we want to get really sick, in my clinical opinion, you're like, oh, let's just go put them on some type of statin drug. We're also looking at an energy molecule in the body called phosphorus that is really important. His iron levels, it checks out. His T4 looks good. His magnesium looks good. His C-reactive protein looks good. So again, what we're looking at this patient, immune system doesn't work. Calcium's not working. He's exhausted. And the body is trying to create this cholesterol mop to literally deal with dysfunction. This is all, you guys, just off a standard blood test. So my takeaway for you is that it's just as important to order the test as it is the interpretation of that. Now, if you're wondering about, oh my gosh, he went through that really fast, I just wanted to tell you that we have something really neat here at our website called Lyme Fighter. It's a free resource. If you go there, I wrote a book on my goal is to help people to get rid of Lyme disease. I didn't come out of school thinking I want to be a Lyme disease doctor. It's just that I've had some success with patients that have had Lyme, and I wanted to share that success with you. Matter of fact, I've got some really neat stories I want to share with you. If you go to the website right here, which is not that one, it is, well, it's westcliniconline.com. You can see this up here. This is Brandon's story, having literally Lyme disease for years and years and years, and he was able to beat it. It's not just me saying it. We have so many success stories of people that were out of hope and out of time. Victoria spent a decade plus basically in a dark basement and trying to figure out what's happening. Greg literally was on death's door, and we got him out of the hospital system, and we were able to get him here and put his life back. You can see his story over here. And the reason I share those with you is these are stories of people just like you that were out of hope and out of time and out of options and didn't have a pathway forward. And they were told that they have autoimmune problems, or they were told that they literally were depressed, or they had melancholy or cyclic mood disorders. And here, let's just put you on, some prednisone, or let's put you on a anxiolytic drug, and let's just really, really help to modulate moods. Oh, by the way, you should eat better. But then they never gave them a structure about eating better, which leads us into the next thing. When it comes to Lyme disease, there's literally 5 rules of health. And the 5 rules of health, I'm just going to write them over here for you, is number 1, it's sleep.
Like if you can't sleep, you can't heal. And so many people with Lyme disease are like vampires. And I say that in a nice, loving way, but what happens is that Lyme bacteria, I feel, gets into their head and it causes some pituitary dysfunction and some pineal gland dysfunction. And so their melatonin levels, which is a modulator for immune system and stress, doesn't work right. And then the next thing is water. I just had a patient today saying, I really don't like water. Water doesn't make me feel good. I just want to get feeling better, but I'm not going to drink water. And the tough love that I had to say in a nice way is like, well, you have to have water to function. Having juices and having Gatorade and having soda and milk and other things because you don't like the taste of water. We need water to detox and flush the system. Then it is, I'm going to call it clean food. It's not just food, it's clean food. And then it's movement. And then what it is, it's how we talk to ourselves. That little voice that says, yes, you're enough and you're worthy of receiving love and giving love. And I'm not harboring stress and I'm not harboring unforgiveness and all of these other things. Like there's a way that's really, really important that helps to clean up the body to be healthy. Okay, so let me tell you some of the other things that we need to talk about with testing, and that's this. Once we do baseline labs, there's some really good tests available. I think one of my favorite ones is an IGeneX test or a Vibrant Health test, which we can do what's called a tick panel. And then we can go over and we can literally do some other testing where we want to look at the barriers to healing. So here's some of the barriers that I see of people that don't get healthy from Lyme disease. And that's this. We have something blocking the healing. Sometimes it's heavy metals. So it could be mercury, it could be lead, it could be basically herbicides, pesticides, microplastics. So all of that stuff is in the environment. And I love doing this test that I'm going to share with you right here called a total tox burden. And a total tox burden test, what it is it literally can tell us, okay, what is in your environment that is blocking healing? Now, obviously, this is a sample test where they have all of these chemicals and problems marked high because it'll give a description down here a little bit. But we can run this and we can figure out, okay, are you getting poisoned from some type of accidental chemical exposure? Is it a environmental exposure? Is it herbicide? Is it a pesticide? Is it tin? Is it nickel? Is it mercury? We can do a specific testing for that. So it's called a total tox burden. We can also look and see in part of this testing, is it a mycotest problem? And what a mycotest is, or mycotoxin problem, that's mold. And mold is no joke. Mold literally gets inside of your system and it literally has tissue that's very, very similar to the liver. But if we have mold in the system, it will block healing. And so what happens is people say, look, I've tried antibiotics or I've tried herbs and cat's claw and salmento and lomatium and elderberry, and I've done vitamin C and I've done vitamin D and I've done shiitake and maitake mushrooms and garlic and burdock root and kyolic, like all of these things that have really some neat properties. And almost always when people do that and they're not getting better, they are getting poisoned by mycotoxins. And so this wonderful, beautiful test over here can tell us, do you have a problem with furosine or ochratoxin or mycophenolics or patulin? Then down here, I'm going to skip down just a little bit. We have a neat way to test heavy metal. So if you remember the movie Superman, Superman's just flying all over the world and saving damsels in distress. And then what happens is he gets around this metal or this mineral that comes from the planet. And it's kryptonite. And what happens is he's just normal, can't fly anymore. That's what heavy metals do to people. Is it, accidental arsenic? Is it those dyes that come from MRI imaging that can be concerning? Is it something from the environment? So we get all of that together. And now we have a plan where, oh my gosh, we have the ability to start decompressing and pulling these things outside of the body. And we want to do it literally gently at a time. We want it to go out through the liver and the kidneys and the breath and the skin. Those are your 4 detox organs that are so important to keep people healthy. And then one of the biggest things of all
is something called this. So let me bring this up here. And this is a way to figure out, are the foods that you're eating really essentially poisoning you? Because that's one of the things that we see a lot of. And by the way, you guys, this just happened to me. So I'm really worried about all these diseases. I'm a closet hypochondriac. I don't want heart problems. I don't want prostate problems. I don't want neuropathy. I don't want macular degeneration. I want my immune system to work. I want to age as healthy and as slowly as possible. And so what happens with that is this. I'm thinking I'm going to eat pineapple because pineapple has these enzymes in it. And what it does is it helps to chew up inflammation and prevent osteoarthritis. And by the way, I really like pineapple. So I'm eating all of this pineapple, and then I do what's called a food zoomer, which this is a demo test of this, but this is so empowering if you have autoimmune or you have Lyme disease. This is so empowering because now we can figure out, okay, what you're sensitive to. So this example test right here, we have wheat that's up here. We have right behind it barley. They're really, really inflammatory. And then we have some foods that are a little bit inflammatory, eggs and almonds and walnuts. By the way, so many times of people that were out of hope and out of options, and we're looking for something different, and we're saying, look, I've tried things. Why do you think that it is so problematic? Like, here's an example of that. Like, if you look at Tana's journey and the warrior that she is, and that she was able to literally take control of her health and beat chronic Lyme disease, what happens is this is the building blocks to help you do that. So eggs, barley are really sensitive. So we have this really neat way of helping you figure out, one, is your white blood cells working? Number two, are the red blood cells working? Is your liver, are your kidneys, are your minerals, are your trace minerals, are your pH, are your filtration, are your energy enzymes? All of that comes from standard routine labs. And then we have the ability to jump in and literally start figuring out, okay, is it a hormone problem? Is it a food sensitivity problem? Like, this is another test that's available. We literally can test the antibodies for foods, and we can figure out, well, which antibody are you making? Which food is putting you into a state of inflammation that is not allowing you to heal? And then we can get in and we can do these total tox burdens with heavy metals, with molds, and we can look at chemicals, herbicides, pesticides, fertilizers that are in your environment and preventing you from healing. Now, you guys, the reason why we're putting this together again is my mission is to not have people live here. It's to live up here. And I feel that Lyme disease is one of the biggest growing infectious diseases that's misdiagnosed, it's mismanaged, and literally people have no pathway forward. So I put together a free resource. It's right here. And if you have that and you drop a comment, we'll either send it to you or you can go to lymefighter.com and get this guide that we've put together so that we can help you whether you're across the street or across the country. It's something that is really something that is our main goal to do this. Now, I'm looking over here in the comments section to go over them. Okay, here's one of the comments. Hey, Dr. West, what's the difference between the treatments that you offer and the treatments that other Lyme literate doctors do? And I would say this, the biggest treatment that we have is something called neural therapy. And neural therapy is a way to reset the nervous system. And it's in a book that I have put together for people, Hidden Secrets to Curing Your Chronic Disease. It's in chapter 10, and we literally line out, look, so many times people have an immune system that is sick, and then the nervous system says, okay, it's normal to be sick. It's not normal to be sick. But the immune system has developed a memory and thinks it's that way. We call that, a nerve memory. It's the same thing. Like, I've had rodeo and rancher guys come into the office, and they'll come in and they'll get a rope caught around their finger, and then, the cow takes off and they'll miss the tip or even the whole finger. And then they'll say, Dr. West, my finger is killing me. Well, what the finger is doing is that nerve's been stretched and it's telling the brain, I heard. We call that phantom limb syndrome. Sometimes when people get their gallbladder out, phantom gallbladder pain, or they'll have an infection like shingles, and it'll affect that nerve root, and then the infection goes away and it still hurts. And we call that post-herpetic neuralgia. So we need to reset the nervous system. We literally do one of the treatments. We take a little type of B vitamin, put it in a super small syringe with a really small needle, and we inject different points of the body, and it makes the nerves open and close and reset. That's one of the biggest differentiators with it. Okay, looking at the other comments here. It says, Dr. West, I've tried antibiotics for years and years. It helped at first. Now it's not helping anymore. Why is that? Well, the question that I would respond to that is because the problem isn't the bacteria. The problem is in the environment. So let me explain what I mean by that. So many times people have a system that is deficient, or there's barriers to healing. Too much herbicides, pesticides, microplastics, and the infection moves in. And what it does is it makes people sick. And then what happens is the medical world is like, well, kill the bug that's causing us. So we dump all of this anti-life therapy into the body. And what I mean by anti-life therapy, anti is against, bio is life, basically therapy. Antibiotics are anti-life therapy. Now, there's no question there's a place for antibiotics, especially in acute infections, and it saved millions of lives, but also the overuse of antibiotics causes problems too. And when people are taking antibiotics and they initially get better, that was the time where we needed to change the environment so that the bacteria basically don't mutate or adapt, and then the infection comes back. In my experience, long-term antibiotics usage is not the pathway forward for Lyme disease. The pathway forward is to stimulate the body to have its own immune system to work, to make sure the detox pathways are there and we're not fighting barriers to healing. All right, you guys, if you've had value from this, please like, share, subscribe, hit the bell, but even more importantly, go right here. Go to lymefighter.com. We have a free resource. You just put your information in and we'll send you the guide. If you'd like to reach out to you, let me tell you, we have some really exciting pathways that we didn't have literally about a year ago. And that is whether you're across the street or across the country, we can really help. We have virtual programs. We help design protocols that you can take to your doctor. We can order the testing literally just about anywhere you are so that we can understand what is blocking the healing. And then we would like to help you create a pathway so that you can get better. You need to be taking the most important vitamin, which is the one that you need. And it's different for everybody. Some people need vitamin A, some people need B5, some people need vitamin C, some people need vitamin E. And by the way, there's some cofactors that are really important for people, and those are vitamin F, vitamin G, vitamin P. So vitamin F is a certain type of essential fatty acid. The old school terminology named it vitamin F. Now we know it's an essential fatty acid that helps to get minerals into the right place. And vitamin P is basically bioflavonoids and rutin factor, which helps vitamin C to work better. And then vitamin G is what they call fat-loving B vitamins, which helps the nerves to transmit better. These wonderful, inexpensive things most people don't even really know about. And so they have a hard time getting better because they don't know of all of the resources that we have put right here. So that's what we're excited to be able to share with you. If you'll drop a comment, we can reach out to you or go to the resource. I'm Dr. West. I'm so excited to share what is my passion, which is helping people's bodies to get healthier. We're here. We're coming back in 2 weeks. We have another wonderful live session. We put a YouTube video out every week. And even more importantly, you guys, we have some wonderful resources to help people beat their disease that you can see. And I was going to show you the resource. It's on our website, westcliniconline.com. You can click on the blog section. I've got hundreds of patient success stories of people that were out of hope and out of time and out of options. So that's what we wanted to share with you tonight. Big internet hugs for everyone. I'm Dr. West, your Lyme fighter. Go check out this resource and this guide for you, and we'll see you guys on the next video.